This condition makes it look like moths have chewed away your bones. Let's get into it. Multiple myeloma is a cancer that affects your plasma cells. Watch this video to see just how bad it can get. Hi, my name is Paige. I have my master's in forensic anthropology. Let's learn more about this blood cancer. When your plasma cells become cancerous, they're now referred to as myeloma cells. And these myeloma cells secrete a substance that's going to weaken your bones. So let's understand how bone is made. First, you have osteoblasts that lay down the new bone. And then you have osteoclasts that break down old bone. The myeloma cells are going to tell those osteoclasts to work overtime. So your body's breaking down the bone faster than it's going to make new bone. And that's how you get lesions and bone weakness with multiple myeloma. This is a real human skull at the Bone Museum in Brooklyn, New York with multiple myeloma. Let's take a closer look at it. The skull overall appears normal. However, when you get closer, you can see lesions caused by multiple myeloma. The early signs of these lesions is this moth-eaten appearance. Imagine that moths have eaten your clothes. That's kind of what this bone now looks like. As the lesion progresses, it gets this punched out lesion appearance, where there's no bone in the middle and the edges are eaten away. Hence the name punched out lesion, because there's no bone in the center. Note that there's also no sclerotic rim around the lesion, which is very characteristic of multiple myeloma lesions. If you're enjoying this video so far, make sure to follow. What's scary about this cancer is that it's going to progress throughout the entire body. You might have lesions or weakness throughout many of your bones. So the holes that we see on the skull might be found in other bones of the body. Other common areas include the ribs, pelvis, and long bones. At the Bone Museum, we have the skull on display upright, so let's take a look underneath to see some more of those lesions. You can see two more lesions forming around the foramen magnum. Another punched out lesion by the left mastoid process. If you look endocranially, you can see the light coming through that moth-eaten lesion that we showed before. Now check this out. If we turn off the lights and shine a light through the bottom of the skull, you can see lesions that were beginning to form in the skull, but have not broken through the outer table. This would have progressed to a punched out or moth-eaten lesion had the person survived. Outside of these lesions, multiple myeloma will often also cause a loss of bone density, which is referred to as osteopenia, or in the more advanced form, osteoporosis. Multiple myeloma typically occurs in patients 65 years or older, and of those patients, 85% of them will exhibit some form of bone weakness or loss. Another condition associated with multiple myeloma is hypercalcemia. This is when your blood has too much calcium in it, and it comes from the bone breaking down and releasing the calcium into the bloodstream. With many medical conditions, we can see the external symptoms, but not the internal symptoms. Here at the Bone Museum, we wanted to highlight how this disease affects the skeletal system. In the United States, the average lifetime risk of developing multiple myeloma is less than 1%. But it's still a very severe disease. If you made it to the end of this video, you obviously like bones. Make sure to follow the Bone Museum for more.